to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing and host of the program. I am so pleased to have Steve Leonard with me to talk about trauma services at TidalHealth Peninsula Regional, correct?
Great, yes, thank you for having me.
Now you have been at Peninsula Regional since 2002, and then it became TidalHealth, and for 5 years now you've been the CEO there.
I have, yes. I took over in 2018, and it was wonderful timing right before the pandemic and mergers.
Oh my. Well, I know the topic today is very important, very relevant at the moment with regards to what's going on with trauma services at the hospital. So let's start with what exactly the trauma services are and why are they needed?
Sure. No, thanks. And again, thank you for having us. I think it's important for the viewers to know we're engaging the audience and really the community in a conversation that's been going on for several years now as we work with the regulatory folks out of Baltimore to help understand really what it costs to maintain a trauma center in Salisbury that really services the entire state of Maryland, as well as a few others that surround us. Trauma is different in the state of Maryland. If you go to the other 49 states, you may find hospitals that are trauma centers, and our Seaford location is a good example of that. It's a community hospital that has 3 or 4 specialties on call every night. But in Maryland, we are pretty progressive. The Maryland Institute of Emergency Medical Services has really written the book on trauma care, and we're proud to be a part of that system. Obviously, the cornerstone is shock trauma out of Baltimore, but we are one of a handful of designated trauma centers that serves the entire eastern shore of Maryland. So that includes everybody who comes to visit from Baltimore and throughout Maryland and those and states around us. And to be a trauma center, to be a designated trauma center in the state of Maryland, not only do you have to have the normal 3 or 4 specialties on call, but you actually have to have about a dozen specialties on call. And you really are providing a higher level of care, much higher level of care when you're talking about neurosurgery coverage, open heart coverage, thoracic surgery, even psychiatry, believe it or not. You name it, there is a whole host. And what that really allows us to do is improve the likelihood of a positive outcome when somebody experiences severe trauma when visiting or when living in our community, and have better outcomes as opposed to other hospitals, even throughout the country, that don't have that level of service. Typically in other states, you would only find this level of service in academic environments where they have many, many teaching programs. But we've been fortunate enough to be that center here on the shore really since the trauma system came about.
So it sounds like you're explaining that trauma services is a whole different animal than, say, just having an emergency room.
Yeah, absolutely. Trauma really is a program, and don't get me wrong, there's many physical aspects that it takes advantage of within a hospital. For instance, our ORs operate 24 hours a day in Salisbury. We are fortunate to have a very large emergency department that sees 80,000 people, but you can have an ER and an OR and not be a trauma center. That program really has the necessary specialties that I mentioned. It also has a highly trained nursing staff, highly trained operating room staff, critical care. It's really the entire scope of services to manage somebody, right down to education for the community, as well as collaboration with other trauma centers. For instance, sometimes we will stabilize somebody here and ship them to shock trauma. Sometimes they'll come right here. Actually, they come here about 2,000 times a year. But it really is well beyond the emergency department, the physical aspect of any emergency department, and all of those wraparound services that provide that higher level of care.
I know there's been some articles in the paper online and such that there's been some financial challenges that you've been addressing. So I guess it affects TidalHealth and all Maryland hospitals in particular. But help me understand why trauma care is so costly.
Yeah, sure. A couple things are happening all at once, you might say. Number one, trauma is expensive because those providers and all of that infrastructure hasn't gone down in price. And more and more physicians are employed by healthcare systems as opposed to being an independent practice these days. And that's an expensive proposition to maintain that level of service. And Maryland is a unique state when it comes to how it manages healthcare costs. We are different than the other 49 states. In many ways, it's a very positive system. The Maryland model has been unique since 1977. It is regulated by a commission out of Baltimore that ensures that there's great access for Marylanders and that we are mindful of cost and quality. But it has challenges, and one of those challenges is it doesn't always reflect an understanding of the nuances, like what we're talking about here. Works well on average, but there are outliers like us that are having trouble where certain costs have not been well recognized by a regulated system. And in our world, we don't decide how much to charge folks. That revenue is regulated. The state says how much we can charge. And believe it or not, it doesn't change with volume. So if volume goes down, that might be positive because I have less cost, or volume maintains itself. Our challenge the last couple years, which has really exacerbated this, is that our volume has gone up 14 to 16%. And in normal business, when you have a volume increase, there's additional revenue for that to match the additional expense. Well, in the Maryland model, we have not received additional revenue. It's been $30 to $40 million of expense, but no revenue. So we always had the trauma expense. For a couple of years, we've been really working hard to get that better recognized. And now we've got this volume expense. And in the Maryland model, more volume does not mean more revenue. You have to work with the regulators to get them to reflect our allowable revenue within their model.
I know, and I guess comment on the fact that being on the Eastern Shore makes us special and different in that we're rural, yet Ocean City, is 30 minutes away, and the population swells dramatically.
Sure. So we service, TidalHealth Peninsula Regional really is unique among hospitals on Delmarva. To find the next closest equivalent, you would have to go to Christiana up in Wilmington. You'd have to go to one of the academic centers, such as a Hopkins or a shock trauma in Baltimore, or you'd have to go down to Norfolk. All the other hospitals have a lower level of care. So a couple things, are unique to us. Number one, we have the privilege of, with that higher level of care, supporting everyone who visits us. So every day of the year, it's 500,000. But in the summertime, it swells up to 1 million if you look at the population between Lewis all the way down to Chincoteague. It just balloons. Mm-hmm. And that's and we're here for those high-end needs. Number two, there's about 6 other smaller hospitals in our region. Trauma centers, being a trauma center like the one we are, allows us to have a higher level of care across all those specialties. All of those other hospitals look to us to send us their complicated patients. So somewhere between 900 and 1,000 patients every year come from these other facilities. Every day there's transfers from these other hospitals to us. Because we have all those specialists. It's really hard for smaller hospitals to have that level of specialty coverage. So if you visit here, you should feel good about you're going to have high level of care. Should something, God forbid, happen, not just a trauma, but it could be a heart attack, a stroke, you name it. And if you live here, we're really proud to support the community with what is essentially an equitable type of care that you'd find in Baltimore. And in many ways, this really is an equity issue. Why do folks on the Eastern Shore, why shouldn't folks on the Eastern Shore have the same level of care that they do in Baltimore?
I'm with you on that. And I know, it's a fine institution, and a lot of people do stay here mm-hmm. and get more complex care. But so with the funding, I know you've been busy going to meetings and mm-hmm. That kind of thing. But what happens if we can't get the necessary funding? What does that mean? Yeah,
it's been interesting. Over the last couple of years, we've essentially supported inadequate funding through our savings account to the tune of $140 million. That really, we can't afford to continue doing that. We've always been fortunate to have a strong savings account, as we say, with our investments. But we have a structural deficit. We need the state to recognize that there's a higher level of service happening here and more volume. And if we can't get that recognized, then we're going to have to make decisions about how much of these specialty services do we provide. Can we afford to continue providing? And I would tell you, we've been dealing with the trauma since about 2017. We've been having these discussions behind closed doors, really working to educate and create awareness. But now with that volume, I've got 2 issues. And now that's what's really been the fact that really is making us bring this to light, because we can't afford to keep doing both. We've actually already adjusted our staffed beds over the last month in Salisbury. And really with an attempt to rein some of those costs in, because our volume is so high. People are sending us more patients, our volume's higher, but the state hasn't recognized the funding. So in many ways, we can't afford to keep doing it. So now, two things. One, we've made some decisions which are impacting patient care right now. If you go to the emergency department this morning, there were people waiting for beds. And that number has risen since we've decreased the beds we're staffing in the building to match what the state's giving us. And that's a problem. We do not like doing that at all. If you're one of those other hospitals that transfers a patient to us, we've always said yes. Meanwhile, if you call hospitals in Baltimore, they'll most likely say, well, maybe. We've always said yes. Well, now we're saying, well, yes, but I got to tell you when we can do it, because it might not be right now. It might be later today. It might be tomorrow. So those things are being impacted immediately right now. If July 1st, we're submitting what's called a full rate application. It's where you work with your regulators to kind of look over all of your metrics, for lack of a better word, your volumes, your cost, all that kind of stuff. It takes several months to do. If the outcome of that is not positive, then we will have to go back and say, we probably can't afford to be a trauma center in the state of Maryland. And that would be devastating to us. It would be many ways devastating to the entire state, because again, we've serviced somebody from every county in the state of Maryland in the last couple years as a trauma patient, not even as an ER patient, but as a actual trauma patient. And that's obviously not where we want to be. I think we're attempting to raise awareness now, so there are no surprises, and we're being just as transparent as we can be. Here's the situation, and really working to have our elected representatives know, who have been very supportive, as well as the regulators, who are working hard on a difficult equation. You know, I think it's important we recognize that the model isn't a bad model for the state. It's just there's a couple of hospitals like ours that are caught in this position where their law of averages and what it looks like across the state doesn't apply as well here locally.
So I guess, what can be done? Is this just strictly awareness, or is there anything people can do? Or?
Well, I think at this point, number one is awareness. And I think, again, we don't want to create alarm, but the last thing we want to do is in 6 months come and say, hey, we're closing this, without people being aware that we've done everything we can is possible, to not have that happen. So I think it's important for people to be aware that, these things are happening. And we're not the only one. If you look across the country, other places are having some similar issues. But I think awareness is number one. And number two, it's also patience and awareness that there are things happening today which could impact their experience in Salisbury, when it comes to some of those wait times. We're actually doing some interesting things. You might be one of those hospitals that calls Baltimore from maybe calls Salisbury from one of those other hospitals that transfers us patients. And our response actually has happened recently, where we say, well, we don't have a bed available in Salisbury, but we have one up in Seaford at our other facility, because we have to kind of work with the capacity. So I think patience, in so far as if you're seeking care, it may be a little bit more bumpy in Salisbury as a result of it.
Well, not to mention the staffing challenges post-COVID. I mean, that's a whole nother matter.
Yeah, and that's right, because the additional volume, it was very expensive because of the staffing. We at one point had over 100 travelers in the building. These are nurses who work assignments for us. They travel all over the country, and that number's pretty down significantly, because again, we've had to limit how much we can do. But yeah, the labor crisis, like every business out there, is not over.
So is there anything the community can do to help?
I think at this point it's awareness. I don't think we're asking people to send letters and make calls at this point in time. But we do think this is an important enough topic that being out in front of the message, especially so people can understand that when they do interact with the system, it might feel a little bit different until we resolve these things. I think that's an important thing for folks. And again, we hope to work this out through the normal regulatory process. That's really our goal on this. It's just working out also means helping folks understand what sometimes you don't always appreciate unless you come here and you have an emergency.
Right, I was going to say, you take that for granted. I mean, people that come to Ocean City for vacay, they're...
And we get letters all the time, people, and again, it's not just the trauma. The trauma allows us to have open heart surgery. It allows us to have minimally invasive endovascular surgery. It allows us to do all kinds of things. So we get letters all the time from people who say, wow, I had this experience. It could have been a trauma. It might not have been a trauma, but every time they come in the building, it's like, wow, we had no idea this was available to us. And again, that's a privilege and honor for us to be able to do that. And it's not uncommon. We'll walk people from the Western Shore through. Could be a regulator, could be somebody from Baltimore or Annapolis, and it's like immediately it's like, wow, we really, unless you've seen many other facilities, you don't always have an understanding as to the level of services that are provided here in Salisbury.
So I guess just to be clear, if trauma services would be eliminated, does that also affect other services that are now provided at TidalHealth?
So again, trauma's a program, so the emergency department would be there. We would take care of people. It'd probably be still very busy. But I think what would happen is that, and this is all data driven, when you have this level of service, your chances of a positive outcome are much higher. From the time you experience a trauma till the time that you receive definitive care, and definitive care means being in an operating room, the evidence says it really needs to be an hour. If we're not a trauma center, sure, we can go to the ER, but then we have to stabilize and ship, or they might just go by ambulance all the way to Baltimore or fly, and that hour has been compromised. And what happens is that your survivability of those most extreme events goes down. And no one wants to see that. That's why we're here and what we do. But that's the very real potential outcome of not having a trauma center over here. And we are uniquely positioned to be it. If you look at our geography, if you look at our history and scope and all the stuff that we do here, so trauma's become impacted. But as well, you have to ask the question: if we're not a trauma center, over time, do we look more like the other facilities on Delmarva? And really, do you have to go to Baltimore more for specialized care? And is that fair to folks on Delmarva? Is that fair to folks on East Shore, Maryland? It's certainly not equitable in terms of really we're here. It should be funded the same as it is funded elsewhere, and we don't want to be there either.
Well, and the population's growing. People are retiring here.
And when you retire somewhere, what do you look for?
Exactly.
Good health care, culture, something to do. I mean, I'd like to think we've helped out some folks making retirement decisions because, am I going to retire someplace if I have a cardiac condition and there's not a cardiac hospital around? Mm-hmm. I might not. I probably wouldn't. So it does have very real implications, not just to the 2,000 trauma patients we do, but really to the entire region.
So Steve, is there a time frame where you hope to see this resolved?
Yeah, great question. So we're trying some interim steps with the regulators in terms of some emergency filings. They're very unusual, and we're not overly optimistic. The stronger potential is July 1st, this filing of that full rate application. And that really, sometimes it can take 9 months. That's a little bit long, but usually I'd love to see a 3 to 6 month time frame. So hopefully by the end of the calendar year, we really have this resolved. Otherwise, that's when we're going to have to make decisions as to really what can we look like here in our service.
So in the meantime, the services that are being provided will be maintained until you get a decision?
Yeah, the trauma center, we're maintaining it much like we've been. We are adjusting our staff beds each day, as I mentioned. But at the same time, other than perhaps some longer waits, those level of services are not being impacted at this point in time until that point where we've concluded that regulatory path. And hopefully we're successful and people feel good about funding us appropriately and we get to a good outcome. Otherwise, at that point in time, we'd have to make a decision as to really what we can do.
Well, that's good news that things will stay as they are for a bit. Fingers crossed, of course.
Fingers crossed, of course.
Yeah, but thank you so much for all this wonderful information and explaining this complex situation we have here in the state of Maryland. And, of course, it's impacting TidalHealth. But I appreciate you coming on.
Well, no, thank you for having me and really having the interest in sharing it with your viewers.
And thank you for joining us for this edition of Focus on Health here on PAC 14.